The COVID-19 pandemic has pushed the healthcare industry to innovate more quickly and more creatively than ever before. But what happens when a language barrier cuts those innovations short? Telehealth has become one of the best ways to keep patients safe. And thanks to Certified Languages International, video remote interpreting can support limited English proficiency or LEP patients at home. Video remote interpreting is one of the best ways to make sure you and your LEP patients communicate effectively while adhering to social distancing regulations. It's also secure, easy to use, and effective. Here's how to use the service. First and foremost, ensure your patient has the minimum system requirements, which include access to a smartphone, tablet, or computer from their home, a functional video camera and microphone, a network connection and Chrome, Firefox, or Safari web browser, and access to email or text service for receiving the secure link for telehealth visit with their video interpreter. Go to hpsm.cli-video.com and use access code 64095-HPSM to log in. Enter any required reporting information. When you're done, click the Submit button. The expert selection screen will show you languages available for video interpreting. Access video or phone interpreters, or if none are available, the button will display the estimated wait time for each option. If there's not a video interpreter immediately available, clicking the button will show you options for scheduling an appointment with the video interpreter or for calling a telephonic interpreter. You can also scroll to the bottom of the expert selection screen and use the Make an Appointment button to schedule ahead. Make sure your patient is available at the time you schedule. Five to 10 minutes before start time, connect to the scheduled appointment by using the link in your confirmation email. You can also click the Go to an Appointment button on the expert selection screen and use the reference number sent to you. Make sure your audio and video capabilities are working by granting browser permission to access your camera and microphone. Notify the interpreter that you will be sending your patient a link to join the session. Finally, click on the Add Expert button in the toolbar to invite your patient. You can invite your patient by entering their email address or cell phone number into the corresponding field. Click the Send Link button to invite your patient to the call. To help your patient get online, follow these tips. Make sure that they are aware that they must enable voice and video capabilities. If on a desktop, make sure they shut down other applications that may be using their microphone or camera. Remember, if needed, calls can be completed using audio without video. When everyone is connected, your appointment can begin. Make sure you talk directly to the patient and not the interpreter. Also, remember that the interpreter must repeat everything you say. There are several features to make the appointment run smoothly. At the top of the screen, you'll see your interpreter's ID number. Below the red button, you'll see options for full screen mode, mute, add expert, disable mic, disable camera. The Add Expert function will show you a list of experts you can pull into the call. You can also bring in a colleague or a patient's family member through the call audio function. The chat function can be used to share prescriptions and assist with in-language translations. When finished, press the red button to disconnect. You can rate your session to help improve the system for future appointments. If you need technical assistance, contact your IT department. You can also send us questions at psinquiries@hpsm.org. Thank you again for your continued commitment to your patients and helping us improve health outcomes for our communities.